I would like to wish you all a very good morning.
Bonjour.
Hello. Welcome. It is such a pleasure to meet again on the occasion of this 14th CHAM convention on the subject of the patients of tomorrow. The strike did not stop us from coming, as we were looking forward to meeting again at the foot of Mont Blanc. When I was a young doctor, we used to talk about the sick, and city doctors had their clientele. The hospital, we were checking out the bladder in room 214. 20 years ago, on March 4th, 2002, when the law on the rights of the sick, as they were referred to then, was adopted. What is the situation today? Those persons who are suffering in their flesh and spirit, called patients today. How can improvements be made to provide medical care and rehabilitation for persons during their active life? And how can we avoid getting sick? These are major challenges that are shaking up the entire organization of our healthcare system. Each person is unique. No people are alike. Medical professionals cannot prescribe stereotype treatments to these unique persons. And in fact, people endure their illness in an environment that is sometimes complex and often stressful, made of uncertainty and multiple steps that people are not used to. They spend all their energy in search of an improvement to their pathological condition. They then gradually resume their activities with eventual setbacks that force them to do things differently than in the past. The road to recovery is long with different obstacles that are made worse by the increasingly technical nature of the services offered and a multiplication of the human resources involved. On the one hand, patients rightly demand the most advanced care harmoniously prescribed, carried out, and followed within a holistic approach, taking into account their environment. They have increasing control over their own destiny, thanks to a gradually growing body of knowledge, providing them with useful feedback, but unfortunately too often polluted by an inundation of unreliable information on social media. Nevertheless, the patient becomes an active participant in the decision-making process for themselves and for others suffering from the same disease, thanks to the expertise gained. On the other hand, the actors in the medical field are more and more dispersed in multiple specialties, and their areas of expertise is shrinking. In fact, you would have an orthopedic surgeon who will operate on your left hand. He will not be the same one as the one who is well-versed in the anatomy of your right hand. So this fragmentation of knowledge and fields of expertise is an obstacle to the overall health care of patients, leading us to rethink the role and place of healthcare professionals, which is very important. Within the health system that needs to be restructured from top to bottom, we must do the following. 1, make the Ministry of Health more agile. 2, integrate the French Hospital Federation, the Federation of Private Hospitals, the private establishments of collective interest, and home hospitalization into a true national health service accessible to all within the framework of a single contract. 3, allow medical staff other than doctors to make a diagnosis and propose a treatment. Will pharmacists, midwives, physiotherapists, nurses, and other professionals not be allowed to have increased responsibility? 4, fight against the unbridled medical consumerism of a society that wants to have access to everything straight away, leading to a dangerous increase in people with antisocial behavior, for example, failing to show up for their appointments. Next, differentiating between error and malpractice, using artificial intelligence and telemedicine, which some people want to limit to one's personal doctor, the closest one. And this does not go together to have telemedicine and closeness. Should we see metaverse as simply a toy to amuse patients, as a policeman who would control everyone's actions? Or can it be seen as an invaluable aid for the exchange between patients and to the training of professionals? The final question is whether scientific and technological progress made, particularly in the field of biology and genomics, is not leading us straight to the temptation of an augmented human being in a Faustian-based world of fantasy. These are some of the themes that we will address, and I would like to now ask Anne-Sophie Joly to join me on the stage.